Are you on a wait list for an autism evaluation for a young child? Or do you have an older child who you can't even get in to see if it's autism or ADHD or something else? Today's guest, Dr. Cheryl Tierney, comes back on my podcast for the third time. She is a developmental pediatrician for over 25 years. She's also a mom to an adult son with autism. She really gets it, and she is the chief medical officer at Meliora Health, which does virtual assessments. In the UK, they have a parent company, but also in 5 states, including Pennsylvania, where I'm from, they do virtual evaluations where insurance covers, it's standardized. They do a lot of support. So today we're talking about wait lists, virtual versus in-person evaluations, what you should look for, how to prepare physically and also emotionally for an autism evaluation. So let's get to this really great interview with Dr. Cheryl Tierney. Okay, we have Dr. Cheryl Tierney back. I'm so excited. Thank you for joining us, Cheryl.
Oh, thanks so much for having me. I'm so excited to be back.
Yeah. So you have been a big proponent in the state of Pennsylvania, where I live for a couple decades now, and now you're on to your next venture. And I wanted to have you back on the show. You've been on twice before, and we can link both those in the show notes. Once on your role as a developmental pediatrician and diagnosing autism, which is a really great episode with a lot of general, ideas. And then in 2022, CDC milestones changed, and you came on the show to talk about the changes. And yeah, there were some pretty big changes. And now, today, we are going to talk about wait lists and how you can get autism evaluations online. You are the CEO, Chief Medical Officer, excuse me, of a company that does this medical evaluations online for autism, also for ADHD, right?
Yeah, we do. We do assessments for both. We do.
Okay. Okay. So, can you tell us about the need for remote? Did this just start during COVID, or was this always a thing and I just didn't know about it?
Yeah. So, interesting. It does stem back from before COVID. It got a lot of publicity and a lot more attention with COVID, but the story is pretty interesting. I was at Penn State at the time, going back a couple of years now, and I was consulting. COVID had just happened, and at the time, we had just started doing assessments online virtually. Everyone was doing that. And I had 3 kids in college, I won't lie. And I said, I could do some private assessments on the side since I can do these remotely now. Maybe I'll moonlight a little and I'll do a little bit for myself back in Massachusetts and New Hampshire, which is where I started my career, 25 years ago. So I had some connections there. So I knew I could get some referrals. So I put up a website, and a company by the name of Helios, which is our parent company in the UK, found my website. And they reached out and they said, hey, we do virtual diagnostics in the UK, and we're looking for someone to just consult with us to give us some tips or insight into the US market, like what's happening in virtual diagnostics in the US, and would you consult for us? And I did. For about 6 months, I was consulting with them. They had been doing virtual diagnostics for a decade, well before. They had done tens of thousands of assessments by the time I met them, and they were the number one, and they still are, the largest supplier of autism diagnostics virtually for the UK and for the NHS. And
And the NHS is their government
National Health System.
agency,
Yeah.
National Health System.
System. Yep.
Yeah, system. Okay.
Yeah. So that's how my entree and became intrigued with this. And I was really interested to learn from them too, because we were just starting doing it in the US. some people had started doing it a little bit, but really there wasn't much attention. There wasn't insurance coverage for it until the pandemic. And so when things switched to virtual, I was consulting for them. And then after about 6 months, they said, hey, do you want to help us lead our efforts from a medical perspective in the US? And I decided after 25 years of academics to jump ship and to try this experiment in the US, because the real push for me was the question we're going to talk about now, which is wait lists. So I had a year wait list for an assessment in my practice in Pennsylvania, and I had left a year and a half wait list when I moved from Massachusetts to Pennsylvania, and that is
Yeah,
not.
even before COVID, people would tell me, and I don't think there was any good published data on this, but even before COVID, people were telling me 9 months to 2 years for a wait list, for autism. And I mean, that's just, you miss the whole critical window, um, of time when you should be intervening, and it would really break my heart to see that and to hear that. And that's one of the reasons for my online courses and communities. And I was all set up before COVID, and people got their appointments canceled that they had been waiting
Yes, it was
year or
terrible.
two for. You started at Penn State Hershey with doing virtual appointments, but at the time, the logistics of just getting online, let alone trying to do anything in a standardized format, right? And
Yeah, it was.
we had Catherine Lord on the show. She's an international researcher in autism, and she does a lot of work with diagnostic. We had her on the show during COVID, and she talked about like meeting kids outside with masks, and everybody had to wear a mask. It's like, how can you evaluate for autism when you're wearing a mask, child that needs to wear a mask? There, you know, it just was a whole different time. But you were telling me, so Milo, how do you pronounce your company?
Meliora.
Meliora. We will link that in the show notes. And you're in 4 or 5 states right now, including, go ahead, tell us the states.
Yeah, so we launched, we were in Pennsylvania, but now we're in Pennsylvania, New York, New Jersey, Florida, and as of like today, just launching it October, we're in Maryland too.
Okay. Okay.
Yeah.
Cool. So you're in 5 states, and you might say, well, you might be listening and you're from not one of those 5 states, or you're from another country, and you might be thinking, well, this is remote. Why can't you just be everywhere? But there are requirements for telehealth that you have to be licensed in the state where you're zooming in out from, right? So,
Yeah,
and also insurance coverage and everything by state, and so it gets logistically really hard. But you do plan to expand more, but and we're not going to just talk about your company or those 5 states. We're going to talk about, you know so there are advantages. Well, one of the things is the wait list. If you are in one of those 5 states and you are on a huge wait list, um then you don't have those kind of wait lists at the moment, right?
right, right. Even when we get a little backed up, it's a month or two. And then we expand a little more and we grow a little bit more to make sure that we don't get much beyond that. So, depending on when you call us, it can be anywhere from 2 to 6 weeks or so until you get your appointment. And so it's just a few weeks away. Yeah.
And that's covered by most insurances, and it's not just eyeballing on Zoom. There are
Yeah.
standardized testing, right?
Yeah, and so that's one thing that I would love to talk about is, how to pick a company that does it right. Because one of the things that also prompted me to jump from academics to this is that I was seeing some companies kind of pop up that did these kind of quickie evaluations. And as a developmental pediatrician, that was really concerning to me that you could take somebody who had never diagnosed a child in person ever and then teach them one tool and not realize the complexity of what it takes to do do justice for this population, right? So it's important to make sure that when you're choosing a company about where to go, whether it's mine or another, because there are other good companies, I'm not saying there aren't, is that you're looking for providers that have a lot of experience and have been trained in autism diagnostics, not just given maybe a couple of week course on how to administer one tool, because um, you're going to miss a lot and you're not going to understand a lot, everything you're seeing, and not knowing what you don't know is a big worry in this area that they're going to be. Now, I think that that's what we can talk about a little bit more about what goes into a good quality assessment, whether it be in person
Okay.
or virtually.
Great. Okay,
The
yeah, because the other thing is going, and I've had lots of experience over the past 25 years, as a behavior analyst, also as a parent, is people bring their kids to me, or did in the past, when I was just starting out, and they'd be like, "Oh, Dr. So-and-so said it's definitely not autism." And I'm looking at the child who's 2, who's clearly not on track. And it's too much what I call eyeballing, and not enough. No,
deep dive.
you need, and I was guilty of it too before I was trained in things like the STAT and the ADOS, to really look at, just because a child's talking doesn't mean they don't have autism, or just because they're pointing at 3 or even at 18 months doesn't mean that they're not going to um, have autism in the future. And I think, so go ahead, tell us about what you would consider, whether it's in person or online, what should we be looking for when we take our young children, or if you recommend places to take clients to for an evaluation.
Yeah. I mean, I want to say that the method by which you do the evaluation, whether it's virtual or in person, to me, is not the deciding factor of quality or not quality. To me, I think there are some things that make virtual assessment superior to in-person assessment. But what you're looking for, whether it be in person or virtual, is the qualifications of the individuals that are providing the assessment and how do they go about it. So if it's multidisciplinary, it's going to be a little higher quality than if it's unidisciplinary. If you're seeing one type of provider, you're going to get one perspective. If you see two types of providers, you're going to get two perspectives. That there includes a variety of sources of information. Families should be queried for their input, but if a child's in preschool or daycare or school, we want to get input from how they're doing in more than one setting. And you want to be able to spend enough time to delve into all the questions that will help you make your decision about the diagnostic certainty of this case. And spending 30 minutes with somebody and then saying they have autism for the majority of kids is really not appropriate. And you want to make sure that you're getting asked questions outside of the autism question so that you can put it in perspective. Is there trauma in this child's history? Is there substance use? Is there are there comorbid anxiety, depression? Is there family history? You really want to make sure that you're getting a comprehensive view of the child's functioning. At the end of the day, finding out your child has autism is just the first step of a very long journey. And are you going to just be told yes or no to this one question? Or you're going to know all the things that are kind of impacting your child and what are the next steps and how to accomplish them. So looking for the qualifications of the individuals, how many individuals are involved in that assessment, and are they able to use standardized measures, standardized rating scales, standardized testing, some standardized way of looking at that child's behavior and development. And then do they offer support after the fact? Or is it just here's your diagnosis and then you're done? So I think there really is a lot of things that families should keep in mind. And only one of them is the method by which we obtain that information, whether you're doing it face to face in an exam room, or I get an eye into your living room and I get to see how they are in their home setting.
So through your company, can you tell us the types of professionals you use for evaluations?
Yeah. For our assessments, we have clinical psychologists and speech language pathologists that do our diagnostics. So you do get two disciplines that are involved in your child's care. Our assessments include gathering information from multiple settings. So you're going to be asked to complete some paperwork and some rating scales. I know that's lengthy or can take a few minutes, but it's important to gather all the information we need. And then you will see both professionals. It can take anywhere from an hour to an hour and a half for each professional to do their piece. So it could be upwards of 3 hours of your time. And it could be a little quicker, depends. For very young children, it might go a little faster, but for older children, we see kids up to age 21, as young as 16 months and all the way through age 21. So if you're 18 years old coming to us, there's more history to gather, and that's going to take more time. And we do
And
standardize.
if you have a 16-month-old, do they have to be in front of the computer all that time?
So they are not interacting with us, right? A 16-month-old is not interacting directly
Right.
with us on the computer, whereas a verbal 10-year-old is going to interact with us through the computer. Our assessments are geared for the level of functioning or the level of communication and their age. So when we're observing, you do have to have a good internet connection and either a laptop or a tablet device, because the phones make it very hard. You can only see a very narrow little bit, so we need a wider view. But you're setting up your camera, and then we're looking into the room, and then we're having the parent facilitate with a 16-month-old, and we're watching the facilitated interactions. So there's activities and things we have you do. And we could talk a little bit about how you might set up differently or be prepared for an in-person versus a virtual assessment, because there's definitely differences of how you prepare for that. That's probably one of the biggest differences. But you're right. We're not going to be asking the 16-month-old to sit in front of a camera. That's not going to happen.
Right. And I've done other blogs on the STAT, the ADOS, the MChat. We can link those in the show notes as well. And you had told me that you use what tool do you use? What standardized tool for the little
For the
guys?
littles, we use the Tele-ASD Peds out of Vanderbilt. It was actually published and developed specifically for virtual administration. And we use that for children that are 30 months and younger. And then once kids get to be above age 3, we move over to an adapted version of the ADOS. So it's not a standardized administration of the ADOS because it's not done in person, but it's very highly adapted from the ADOS. And then we use the CARS as well.
Okay. Yeah. And would you say most of your diagnostics are under 5 for sure?
Uh, you know, I'd say
Mhm.
there's two areas, the littles that are getting in really early now. I call them the littles. Those are my favorites. I love the littles. Maybe because I have an adult son with autism, I'm starting to like the olders too, because he's old. But the littles, there's a big spike in those, getting kids in by age 2, right? So that's amazing. But a lot of centers around the states we're in have closed to seeing older kids, that they have started to manage their wait lists by limiting the age that they'll see. And so now these older kids that have difficulties that may have been missed, or families now have concerns, have nowhere to go. And we're an option for that. So we do have a spike of the older ones too, where they say, oh my God, you can see us. We've called 10 places and nobody will see a 15-year-old. So yes,
Or
I would
even a
say both.
6-year-old or an 8-year-old that is, struggle. There's a good subset of kids that are entering kindergarten that never were evaluated. And the danger is these kids are then kind of being like they're the bad kid. They have emotional disturbance when it is actually autism or ADHD. And when I got trained in the ADOS years and years ago, I was never certified or anything, for research, but I did get trained, and part of it was assessing to see at the different levels of the ADOS. And I had this little girl come, and she was probably 8 or 6, and did the whole ADOS. And I mean, I was never in a position where I was able to diagnose or, but it looked like she didn't have autism by this ADOS, but probably more ADHD. So there is, and we've done blogs and podcasts on ADHD versus autism too. And I think it's really important that older kids, like you said, have the parents of the older kids have a place to go, that's online, that's convenient, that will take them, that will take their insurance, and it will be because those kids, I mean, you and I could both look at a 2-year-old with severe autism and be pretty sure. An 8-year-old with all kinds of language, with all kinds of potential comorbidities, it's really, really hard to dissect it, and without standardized testing, I wouldn't trust it.
Yeah, I will say, you bring up such a good point. The ones that I feel like this is why you need somebody experienced who has really knows this population and how to assess. How do you tease out autism from ADHD when kids are highly verbal and maybe some hyperactivities? Maybe they have both. Maybe they've been misdiagnosed as ADHD and they really have more mild or high functioning autism. We One of the things that I find is nuanced is where the CARS standard becomes the CARS high functioning and which tool to use and the age at which you can use the HF version of the CARS, which is what a lot of places do. They're too old to score them on a standardized way using the tool that assesses for more language, but um, they fit in that window, that gap. So they might be 6 years old and they're not coming up positive on the CARS, the standard CARS, but they're not old enough for us to use the HF version, which is for the older kids. And so you have to use your clinical judgment a lot. And this is where having clinical judgment is because you've had training and expertise and seen thousands of kids. And so I really think that these more nuanced cases is where having that expert clinician is so important. Yeah, you're definitely right. We're also seeing kids that maybe were too subtle and people weren't noticing, and then they hit kindergarten, and the teacher brings up concerns. And then the parent goes, oh, we noticed maybe a little bit, but no, my pediatrician didn't bring up anything. They developed all their language milestones on time. They
Or they
didn't have,
were told, "No, it's definitely not autism," when they
oh,
were 2
definitely not
or
autism. And
3.
then they get to kindergarten and they're like, oh, they're really struggling socially. You need somebody who has expertise in dealing with all these nuanced populations and being able to help put it in perspective amongst other diagnoses that could be competing or comorbid. Yeah, 100%.
Yeah, and you also have, within your company, the ability to take kids in for medical management where they've already have the diagnosis, which we're not gonna get into today, but that's a whole other a population very much in need. Um, Again, you have to have the expertise behind the people who are doing the evaluations and as standardized as they can get, so that you can really flesh out what it is. And most importantly, you don't just send people away with a slip saying you have autism. You're referring to what kind of things do you refer to once, say one of these little children get a diagnosis? What kind of referral or
Yeah.
long term, do you see them again? And yeah, what do you do?
What do I do? Yeah, I mean, to me, finding out that your child has autism can be oftentimes a really traumatic experience for families. And so we want to give them time to process that and understand it. At the beginning, sometimes it's a little overwhelming and you're thrown a report that has 25 things in it and you're like, okay, I don't know what to do next. So the things we typically recommend, particularly for the littles, would be making sure they're getting early intervention, making sure they're getting speech OT if they need it. Some kids need physical therapy as well. They may need help with more social aspects of language, so making sure they have a special instructor or developmental specialist who can help work on play and social interaction skills. ABA services, of course, for the young children, trying to help them with skill building and maybe some of the behaviors that are challenging parents to get them ready to succeed in mainstream classroom when they turn school age. All the work that we do to get them prepared and successful to launch into the academic arena. And then they may need help with medications. They may need help with um, sleep. They could need help with toileting. There's so many behaviors, eating, picky eaters. There's just so many things that families struggle with that maybe your pediatrician may have a little less expertise in this handling in this population. And we provide all that aftercare as part of our developmental medicine program. And many other good centers will do that as well. They do the diagnosis, but also the care, the longitudinal care afterwards, your developmental medical home, so to speak.
Yeah, that's great. Um, so what kind of things, whether you're in person or remote, say somebody's listening and they have an evaluation coming up in the next week or month, like how do you prepare? You know, what should you bring? What should you gather at home if you're doing it remote? Let's just start there, and then we're going to talk about how to like emotionally prepare.
Yeah. So for in-person evaluation, I think the things that you can do to prepare is to get a sense of how long the evaluation will be. How long will you be there? Planning ahead for the trip there and not showing up right in time for the appointment, but getting there a little early, not too early where your child maybe gets bored and starts to act out, but enough where they can transition to the environment without feeling pressured to transition. A lot of our kids do struggle with transitions. And so being there maybe 10 or 15 minutes early, not feeling rushed, bringing snacks and drinks with you because children often, many of these centers will allow you breaks and the child may just need a little bit to drink or a snack to like break it up. And you know your child best and what snacks they like. A lot of places may have snacks, but what if it's not what your child likes to eat? A lot of picky eaters out there. So bringing your child's favorites to that day is not the day to have to make them eat their green beans. It's the day for more fun snacks to make it more palatable. Bring maybe one of their favorite toys with them, but be prepared if you know your child is going to be upset having that favorite toy taken away, don't come with it because oftentimes they have to go into the testing room without their favorite things. And then they may set them up for a negative behavior transitioning into the exam room. So think about all those transitions and your child and how they would do best. And then just think about if I have to take this away because they don't want this lovey in the exam room, is my child going to have a 30-minute temper tantrum when I take it away? And then that's going to not allow them to participate. So those things. When in a virtual, it's completely different. You're in your home. And oftentimes the place that's doing it will send you instructions about how to prepare. Almost always it will be involved based on your child's age, the activities that you're going to do with them. So for very little children, it might be gathering a few toys, maybe getting some balloons and bubbles, making sure you have cars or crayons, things that your child likes to do. And typically not electronics because they'll get very, very engrossed in the electronic device and not want to participate with you. So gathering the materials that you might need, making sure you have a good internet connection, making sure you have the right device, make sure you have a plan for what to do with the other children in your household when you're dealing with your child. If there's an opportunity for 2 adults, that's always better. But if you're the only one there, if you have a 2-year-old and a 4-year-old and the 2-year-old's being evaluated, who's going to be with that 4-year-old? So making sure you're the right candidate for telehealth is to also think, not just do I have a cell phone that I can put up there, it's do I have the materials, do I have the right technology, and do I have the right support system for maybe making sure the dog is out of the room so they're not a distraction, making sure the other children have a plan, scheduling it maybe when the older children are in school so that you're home alone with the child that is going to need the assessment. There's different factors that you have to take into consideration, but if you have an instruction sheet that they give you about how to prepare, make sure you review it and not the morning of the assessment, review it ahead of time. The more prepared you are, the more successful your assessment will be.
I love that. And you know, I have bubbles right here. I've got things right here because they're used so frequently. to test for joint attention and those sorts of things. I will add, if you have gather crayons and you gather the cars and everything, have it in a little box, like, don't bring everything out,
Wonderful.
because transitioning between items can get dicey too, and they're gonna give you directions, like, "Get out the bubbles, but don't say bubbles," or, that's just an example of what they might do because they don't want at that moment to test a echoic response. They want to test, them looking at you or them reaching for you or handing it without looking. So I think those are really good tips, and like, the dog and the other children, and, managing that, like pretending like this is an appointment I've waited for 9 months. I mean, even if you're not waiting, like, I need to make sure that I can concentrate, that my child, I can support my child, because and they'll also help you if you're online. If your child throws a fit, they might be able to, like, give you some tips, like, to
Brilliant.
get them back on track, but I've been in situations. I actually talk about this in, chapter 9 of my book, Turn Autism Around. Um, One of my long-term clients that I helped between the ages of, 2 and 5, or, they had another baby, and that baby turned 3 right at COVID when he stayed home from daycare, and for 3 months. Mom and dad were both working from home. They started to get panicked, like, does he have autism? Because he was starting to, like, throw bigger temper tantrums and that sort of thing. So, I never do this, but I got my stat bag, and I was just like, "You know what? Let me come over," because they really trusted me, not to make a diagnosis, just to give them some support, and, like, literally, it is hard to tell with 3-year-olds that are completely verbal. I wouldn't trust many places to actually look. Anyway, to make a long story short, I had my stat bag. They said he loved cars. I got the car out to roll back and forth, which he loved. But then it was time to move on to the next thing. And he threw like the biggest tantrum. And the parents are like, "We'll buy you a yellow car tomorrow." And they're like reinforcing it. And I'm like, "Oh, this is not going well." But even with my 25 years of experience, it was tough. So don't think like, and the child did not end up having autism or getting it evaluated. Like, he was just at home too long, too much iPad time. We talk about virtual autism, a few probably months ago at this point when this is going to air. But you know kids can look, kind of bad if they don't get enough engagement, and if parents reinforce inadvertently, of course, problem behaviors, they can look really problematic. But, you know, having the materials, but waiting for directions of how to present that, I think is really, really key.
Yeah, you made a point I wanted to maybe underline, which is why, as part of our assessments and many others, speech pathologists are part of the team. Because when you have a verbal, um, a child that doesn't have like classic delays in their communication development of speech or language, you have to be able to be an expert in assessing their social use of language. How are they using language? Are they using it appropriately? And delineating that from kids that maybe do have more mood or regulation problems, maybe more ADHD or more depression or anxiety. And like, how do you, or just global developmental delays, or more delays. And obviously those kids would have less language too, but being able to assess how they're using the language they do have, whether it's a little bit of language or a lot of language. And that, a huge shout out to our speech colleagues who are really expert at assessing that and giving an idea, really bringing that expertise to the table is invaluable. And I really love the multidisciplinary model for these kids.
Yeah, I love that too. Yep. Okay, so before we wrap up, how do parents prepare emotionally for an evaluation?
Yeah. Um, you know, we see all types of families, families who have been waiting forever, know their child has autism and is are desperate for a diagnosis so they can gain access to services. And some families feel relieved to finally have been heard. They've been saying it for a while, no one's listening. And so you get that relief. Um, and we see families who didn't see it coming. Somebody mentioned it to them and they didn't think so, but they were going to get it evaluated just to be sure. But then it turns out their child does have an autism spectrum disorder. So I will say that there's such a wide range of response that it's hard to give a one size fits all for how do you emotionally prepare. But I will say this, whether you were expecting it or you weren't, there's a grieving process. And giving yourself permission to grieve and take the time that you need to process it and to understand that your child having this diagnosis doesn't mean that they won't lead a happy, fulfilling, exciting, successful life. And maybe for some children that may look different. What you're grieving is maybe these expectations of what you felt your child's trajectory was going to be. And now you're going to a different destination with that child, but it doesn't mean it isn't a happy destination, that it isn't a positive destination. For some, it'll be really challenging for the rest of their lives. That is the reality for some families, but that is not the reality for all families, and every family is different. But taking the time to process that grief, allow yourself to feel that way, not to feel guilty about it, that is normal. You don't have to jump into planning your child's next 60 years, 70 years, 80 years, the minute you get that diagnosis. Taking a couple of weeks to just sit with it and process it will not change your child's outcome, long-term outcome. We're talking about early intervention so that your child gets help and it doesn't take years to get into intervention. We're not talking about whether or not you delay things a week or two. That's not going to change the long-term outcome for your child. So allowing yourself that space. And I will add one thing, which is that some families need counseling. And I do talk about counseling. It's a very high incidence of divorce in families raising children with special needs. And even if you have a happy marriage, it will test your marriage. If you're a single parent, it will test your ability to feel successful as a parent. And so whether it's marriage counseling or family counseling or individual counseling, I really feel that can be a really good adjuvant to help you with your mental health, because if you're happy, rested, and in a good space, you'll be the best parent you can be.
Yeah, I love all that. And in fact, it reminds me of a couple things. So at Lucas's diagnosis day at Children's Hospital Philadelphia with Dr. James Copeland, who I did a podcast with years ago. We can link that in the show notes. It's a really good one. He told us we needed marriage counseling because we were like, we got the diagnosis, and then my husband's like, well, when Lucas asked for milk in the middle of the night, I think Mary should just give him water from upstairs, but she thinks she should go downstairs and get milk. Well, like, what should we do? And he's like, you need marriage counseling, because if you're fighting about milk and water, then you've got bigger issues. So then we're on the way home, and I'm crying, which I'm not a big crier, but talk about grief. And my husband's saying things like, well, I guess he'll never get married. He'll never go to college. And I was like, shut up. Like, your brother's not married. He didn't, like
Lots of
all,
people go to college.
all,
Not
all,
everybody,
yeah, but all those expectations of, I was like, Spencer's only 18 months now. We don't know what's going to happen. Like, all my expectations, my whole worldview changed in the car ride home. Literally. It was like, but I will say, and I interviewed my husband for a podcast, which we can link in the show notes too. It's going to be a big show notes section. But, he talked about how he was overly pessimistic and I was overly optimistic. But I think there's a good reason to be overly optimistic. I mean, I did a podcast solo show on some new research in 2023 that was put out by Boston, showing 37% of kids diagnosed between 1 and 3 could not need a diagnosis between 5 and 7. And we can link that in the show notes. Like, I have a white paper on a little girl whose mom was gunning for a diagnosis, got it in February of 2020, got the diagnosis, but then everything fell apart. She did my online course and within 33 days went from 2 words to 500 words, like amazing progress. And so I think on the way home, yes, you can cry. Yes, you can grieve. Yes, you can. I told somebody doing a workshop one time when I was still really like, he's gonna get all better kind of attitude. I mean, this is back in the 90s when that was all the rage. And he's like, well, it's okay to grieve. And I was just like, I am grieving 3 to 5 years of age of not having a normal childhood. I'm not grieving a lifelong challenge.
Right.
And Lucas has severe autism, and he still has severe autism as an adult. And he has a good life, and I have a good life. So even if you have challenges, um, I think there's a reason to be optimistic. And with companies like yours, you know, while you're in 5 states now, hopefully you'll expand. Hopefully there's more companies and more places that are going to make evaluations, diagnoses, medical management a lot better. And it sounds like you guys are really, really doing a great job.
Thank you. I loved what you said, that you're that you are you can grieve. That I want to give people permission to grieve, but then I want them to be optimistic, because if you don't set high enough expectations, you'll never you will never reach an expectation that you didn't set for yourself, right? So setting high expectations and having high expectations is a great approach, because I can't tell you how many times I've heard families say to me, I never thought he would ever do that, and he can do that. Or I never thought she could do that, and she's doing it. And I'm like, exactly, because this diagnosis doesn't mean you will or won't do any one thing. So it does mean that we may have to work harder to get there, but it doesn't mean that you won't achieve that goal. And having that positive attitude is so important. And I too have an adult son with autism. So I have maybe 22 years, almost 22 years of experience, to be able to look back and say, if I could give my younger self some advice, I would have said, worry less, because the worry doesn't change anything. Yeah.
Right. And you're going to have more challenges in your life. I say, like, your name doesn't get out of the lottery to pick more issues and more challenges that are going to come up. And so it's okay to grieve. It's okay to have change your whole worldview. Um, and it's imperative that you take action and just keep moving forward. To help your child. So we'll link your company's website in the show notes as well, and parents can contact you or your company to schedule evaluations to see um, if they take their insurance and get settled, and then speech pathologists and psychologists that are looking for remote work, like you got started part-time, full-time. I mean, there's a lot of good things that can come from remote evaluation. So I think we're gonna end it there. I don't want to go too long, but I do appreciate your time and all the insights, and look forward to future collaborations, which we've been collaborating for many, many years, and looking forward to just helping families. We're on a similar mission.
Thank you so much. It was great to be here.